Under this plan and the way Republicans are reforming or would like to reform Obamacare, what does it do for pre-existing conditions?
Rove is essentially right. You're going to get to keep the insurance you have, as opposed to what was promised 9 years ago. You're going to get to keep it with a pre-existing condition unless you're in a state that asks for a waiver and has something in place like a high-risk pool where they could separate out somebody who's very sick who has a lapse in coverage. In other words, it's not everybody. If you're in a state that asks for a waiver, you still have your pre-existing condition covered under the Obamacare type insurance unless you lapse. And then you go into a high-risk pool where you're still covered. Here's the only problem, and it's going to only affect a small number, Bill. If you're in that high-risk pool, what are you going to pay? And that's where I say the government's got to step in and heavily subsidize those pools, because the Kaiser Family Foundation said high-risk pools can work, but they're traditionally underfunded. Let's not underfund them. $8 billion that's been proposed in the current bill is not enough. So high-risk pools for people who lapse in coverage in states that ask for waivers only. Otherwise, Rove is totally right. Almost everyone is going to get their pre-existing condition covered.
It'd be covered.
Right.
So when someone makes a claim that they won't be covered, they're wrong. Is that what you're saying?
It's just derisive, emotional talk to rile people up. It's not fair, and it's not accurate.
Got it. Two more issues here. And the piece you wrote over the weekend for the New York Times. You gave two great examples. I want to illuminate them, okay? Following is this. A woman age 60 comes to see you every 2 weeks. She thinks she has allergy problems. You conclude she does not, but she still comes back to see you. Why is that bad? Or wrong, or what would you do about it?
Well, she thinks she's infected, and I can't prove it till I see her. Okay, so when I see her, I can tell she's not infected. And there may be something else going on, but I have to see her to figure it out. But here's the thing. I and many other doctors have to practice defensively these days because we're afraid of missing something or being told we missed something. That's tort reform. The other issue is the insurance system that we have doesn't allow us to charge people more who overuse the system. There's an awful amount of overuse involved, along with a lot of sick people, by the way. I mean, people use insurance a lot in the last 2 years of life. We have a lot of technology. We have an innovation. This is a very expensive healthcare system. On top of that, we're overusing it.
What is your solution to an issue like that if there is overuse in the system?
Frankly, I think doctors should be paid less for seeing people unnecessarily, and patients should pay more for overusing the system.
More burden on the patient.
Absolutely.
Okay. The second
Premiums
example,
go up if you overuse your car insurance, don't they?
Yeah, that's true. Second example you give is your 93-year-old father who has a heart condition. He has a piece inserted into his heart, and it cost $50,000. Why do you use that anecdote to make what point?
Well, by the way, thank God my father's alive, and thank God the valve worked. Thank God it worked.
Warrior.
I made the point that in the future, Medicare may not be able to cover all of this innovation, this personalized solutions. A valve like that is only covered probably because some lobby fought for it. Meanwhile, Medicare is not covering enough wheelchairs, Bill. Medicare is going bankrupt, and one of the reasons is a good reason. We have great technology. In the future, that valve may not be covered, so I was making the point that maybe we ought to start saving now with health savings accounts. We have retirement accounts. We have IRAs. Why don't we have a health savings account along with it so that when you get to that age, if God forbid the valve isn't covered? A lot of critics said, wait a minute, you don't want your father to get that valve? Of course I want my father to get that valve. But if Medicare were to turn him down, he'd have another way. And that way would be a more private way, which, by the way, you could take your health savings account and argue, hey, I don't want to pay 50 grand. I want to pay 30 grand. I want to pay 25 grand. And you could negotiate the price.
All of that goes to costs and what's affordable and what's not. Very interesting.
One final point. I want the government to step up also and increase the number of federally funded clinics they have in National Health Service Corps, which currently takes care of 10 million people, and the clinics take care of 22 million people in rural areas. I want to double that so that nobody can criticize our federal government or Donald Trump and say, you don't care about poor people. Let's provide the care directly to people who don't have.